acceptance of all solutions that we propose. I'm not going to speak about that very much. You're keeping an eye on time, okay. But just to mention that active transport is something that we work quite a lot on in the European Centre for Environment and Health. Just because there are so many opportunities in that field, the travel patterns of Europeans fit the needs perfectly, because so many trips done by car are short trips. They are done in urban environments, and they could actually be easily replaced by walking and cycling, where the opportunity is right to facilitate those choices. We know that one of the most frequent arguments of people why they are not physically active is that they claim they don't have time. These are the same people who probably watch TV 2 to 3 hours a day. Nevertheless, they, in their perception, perceive that they don't have time. And there is no use in telling them, you do have time, just replace the TV watching. This will not work. So we have to be mindful of the restrictions that people perceive in their life. And walking and cycling somewhere where you have to go anyway will make it very easy for them. Instead of maybe having to go somewhere, especially when time available. Again, options need to be equitable and easy, and cycling and walking provides for that, because most people can do it. It doesn't cost a lot of money, and it's enjoyable, given the right environments, of course. What do I see, or WHO see as a possible role of the sports sector in all of this? Of course, the sports sector is very important to support the policy response to address these challenges, and I think very much is already done in this field. The sports sector can be open to connect with related policies rather than trying to stay in their own field, and I've seen a lot of movement, especially in the recent years, from different sectors, including sport, to work more across the sectors and together towards the common goal of increasing physical activity. It can help to disseminate a culture of active leisure beyond elite sports and beyond the classic sport activities, using a broad definition of physical activity rather than a narrow sport definition. It can support provision of healthy environment and healthy choices to ensure access for all, and of course Sports for All is a classic, wonderful example for that. It can engage with local, national and local governments, because many of the solutions have to be provided on the local level, where people work and live. So the community level is very important. And it can help to develop and deliver community sport programs as a means also for community-wide mobilization, because of course sport can be very important for social mobilization, reclaiming of spaces, improving public safety, etc. And again, Sports for All is already contributing to that. Now to the last part. WHO's mandate for action goes back about 10 years, so this is a very young field, as you're all aware, of course. The two most important ones I want to point out here are the Global Strategy on Diet, Physical Activity and Health, which was endorsed by the World Health Assembly in 2002. The preparation started in 2002, and then it was adopted and endorsed in 2004. This is now, of course, a very important basis for a lot of the work that we do. WHO developed a number of different policy tools for action to support member states in implementing the global strategy, and you can find them on these websites. One of them, a very nice guideline to increase levels of physical activity, which identified a number of key success factors for physical activity promotion policies. And I guess you'll agree to many of them. We need political commitment, first of all. Without that, nothing will work. Knowing from where you start, so having surveillance data, It's very important, working with other stakeholders, integrate international strategies and policies, but also work at the local level, respect the local reality, also invest into the workforce, so into education of practitioners, etc. And of course monitor and evaluate what you're doing, what works and what doesn't work. In the European region, we've endorsed the Charter on Counteracting Obesity as a part of the implementation of the global strategy. The second action plan for food and nutrition has just been endorsed by the regional committee, and as it was initially discussed with member states whether a separate pillar of that action plan should be on physical activity, but actually it was decided that physical activity was too important to be only a pillar, I'm saying in square brackets, of the action plan on food and nutrition, and that's why a separate document was developed, Steps to Health, a European framework for the promotion of physical activity for health. The Charter, as many of you know, and some of you probably present, has been adopted at the Ministerial Conference on Counteracting Obesity in November 2006 in Istanbul. It recognizes and underlines the importance of physical activity as a part of the solution next to healthy nutrition. And it promotes physical activity, and again, the ensuring of opportunities within its goals and principles, and member states have committed to that by endorsing the Charter. I'm not going to speak very much about the second action plan, but one of the related areas speaks also about physical activity, so it makes linkage to that topic. And mentions it in different specific actions. An action plan has been developed which aims at both nutrition and physical activity. This document, some of you may know it, you're very welcome to take copies in the back of the room, is a call for action which has been presented at the conference. It calls for awareness and attention to physical activity as a health determinant, but it encourages and inspires national action. It doesn't only call for action, it also gives guidance and presents practical tools for member states who want to do something in this area. So it's meant to serve as a guide for member states in implementing physical activity. It's also available in different languages. As last, few selected activities and products that can be helpful for you to be aware of in this area. We've developed also in the framework of the obesity conference 2 advocacy booklets on physical activity and health, and copies of the more general overarching one, Physical Activity and Health in Europe, Evidence for Action, can again be found at the back of the room. They're aimed at policymakers. They're advocacy products. The language is very simple. It is not for scientists. It is really for policymakers. And the feedback we've received from member states, including apparently from ministers who've read it, and some of them said that for the first time they understood what physical activity and health meant. So we seem to have achieved what we wanted. And they're also available in a great number of languages. I think we're at 8 languages now, including Slovenian, Danish, Italian, Russian, of course, etc. So please go to our website and download them, or consider, if they're of interest to your country and not available in the language yet, to translate them, because we very much encourage that and make the templates available. Very briefly, the key messages. We don't need to wait any longer. The evidence is available. We can act. We can start acting. There are still some open research questions that we will certainly invest into, but that's not a reason not to act. Physical activity should be integrated in everyday life. That's the only way that we're going to reach the millions and millions of people that we need to reach. there are experiences available on what works in different sectors, so there are good examples that we can follow. The health system has a key role to foster multi-level coordinated actions in many ways. And also very important, physical activity is an individual responsibility, but it is also a societal responsibility to provide the environments that make it possible to be physically active. And that has been really a paradigm change, I think, in many heads, and a very important step, also reflected in the obesity charter. We have also developed an online inventory of documents on physical activity promotion to make the existing documents and experiences available, because there was an increasing interest in the national activities, but no real overview existed and an easy way to access those experiences. So we've established this inventory, which now includes about 400 documents from health, sport, transport, and environmental approaches. So not only health, we're taking a very broad approach here. Including in those 400 are about 50 national policy documents from 23 countries, and we're continuously including more and more as they become available, as an example for others to follow. These will be printed out so you can go to the website yourself. Another area that we're doing quite a lot of work in is to develop guidance and tools for economic valuation, because money is a language that politicians understand very easily. And if you can present what it costs or what you can gain, then people will listen to you. It is also a tool that other sectors, like the transport sector, use as a standard tool. So it will help us to speak their language if we develop similar tools for them to use. So we've started with support from Austria mainly, but also Sweden and other countries, to develop guidance and a very practical assessment tool to assess the cost benefits from health effects from cycling and walking. The tool currently is on cycling, and the only two figures, you can't see because it's too small here, that people have to put into this model, which is based on an Excel spreadsheet, is the number of trips